Welcome to this in-depth exploration of electromagnetic neuromodulation and its diverse range of applications. Over the course of this presentation, we will take a detailed look into the various brain stimulation techniques and the groundbreaking technologies that are shaping the future of neurotherapy. These technologies hold the potential to understand and treat brain disorders. We begin by discussing two widely researched and applied non-invasive brain stimulation techniques: repetitive transcranial magnetic stimulation and transcranial direct current stimulation. Both methods are used to modulate neural activity, offering an effective way to treat various neurological conditions without the need for surgery or implantation of devices. These techniques work by either applying magnetic pulses, rTMS, or low electrical currents, tDCS, to specific areas of the brain, influencing brain function and improving symptoms in patients with conditions like depression, chronic pain, and among others. As we progress through the presentation, we will also explore more invasive and emerging techniques such as deep brain stimulation and the cutting-edge field of brain electromagnetic implants. These advanced approaches, while more complex, offer the potential for personalized treatment and real-time adaptation, providing patient-tailored interventions for serious neurological conditions such as Parkinson's disease and epilepsy. In addition to traditional therapeutic techniques, we will look at how these innovations are converging with modern technologies to enhance brain health and even interact with brain-computer interfaces. These tools represent a transformative shift in treatment and rehabilitation for patients suffering from brain disorders. This slide introduces the electromagnetic spectrum, which showcases the range of frequencies used in neuromodulation therapies. Electromagnetic fields can vary greatly in frequency, from very low frequencies to the high frequencies associated with microwaves. We begin with the static field, a type of electromagnetic extend up to an extraordinary wavelength of 1.5 million kilometers. This field, although not commonly used for therapeutic applications, represents the lower end of the electromagnetic spectrum. Moving upward in frequency, we reach the extremely low frequency range, which operates around 50 Hz, with a wavelength of 500 kilometers. As we continue up the frequency ladder, we enter higher frequency ranges such as VLF, very low frequency, and radio frequency, progressing to microwave frequencies around 3 GHz with wavelengths as small as 10 centimeters. The relationship between frequency and wavelength determining how electromagnetic fields interact with biological tissues. Lower frequencies, such as those in the ELF range, are generally used in non-invasive therapies like rTMS and tDCS because they can penetrate tissues more effectively without causing harm, whereas higher frequencies, in the RF and microwave ranges, in treatments such as hyperthermia for brain tumors, where they are used to heat targeted tissues to therapeutic temperatures. In this slide, we dive deeper into the non-invasive electromagnetic neuromodulation therapies. These include two prominent techniques, tDCS and rTMS. Transcranial direct current stimulation involves the application of a low-intensity direct current to the scalp. By using electrodes placed, this method modulates the electrical activity in the brain. tDCS has been shown to improve cognitive performance, reduce symptoms of depression, and promote brain plasticity, making it a promising tool for treating a variety of brain-related conditions. This technique is widely used in clinical trials and has received growing potential in neurological rehabilitation. Repetitive transcranial magnetic stimulation works by delivering magnetic pulses to the brain, which induces small electrical currents within the targeted neural regions. rTMS is particularly effective in treating depression and has been shown to help patients who have not responded to traditional medications. It is also being explored for other conditions like anxiety disorders, stroke recovery, and chronic pain management. Both tDCS and rTMS represent the forefront of non-invasive treatments that enable physicians to modulate brain activity with precision, offering alternatives to more invasive procedures. The focus of this slide shifts to deep brain stimulation, DBS, a procedure that involves the implantation of electrodes in specific areas of the brain to send electrical impulses that can modulate brain activity. DBS has been used for decades in the treatment of Parkinson's disease and essential tremors, and its applications are expanding to disorders such as obsessive-compulsive disorder, OCD, and depression. In addition to DBS, we also explore the exciting potential of brain electromagnetic implants. These implants, such as the responsive neurostimulation, RNS, system, represent a growing area of interest in the field of brain-computer interface. RNS systems are designed to detect abnormal brain activity in real time and deliver corrective stimulation to prevent seizures. Unlike traditional DBS, RNS systems are designed to adapt based on the patient's unique brain patterns, offering a personalized approach to treating neurological disorders. These technologies are the future of closed-loop systems, where the brain and implant communicate directly to optimize therapy. This real-time adjustment provides a tailored treatment experience, which is particularly valuable for conditions that require dynamic modulation of brain activity. In this slide, we delve into the cutting-edge research surrounding brain-computer interfaces, BCIs. The fully implantable wireless brain-computer interface is a major milestone in this field. These systems enable seamless communication between the brain and external devices, without the need for bulky external equipment. Using the power of wireless technology, BCIs have the potential to restore lost functions in patients with neurological disorders, such as those with spinal cord injuries, stroke, and neurodegenerative diseases. This advancement paves the way for real-time brain monitoring, the development of neuroprosthetics, and even direct brain contractions, offering exciting new possibilities for neurorehabilitation and the enhancement of human capabilities. Moving on, we explore brain hyperthermia treatment, a novel therapy used in the treatment of brain tumors. The concept behind hyperthermia is to use heat to damage or destroy cancer cells, which are more sensitive to temperature changes than normal tissues. This slide presents a study on hyperthermia treatment planning, which includes spinal fluid convective flow to better manage the temperature distribution across the brain during treatment. By controlling the temperature precisely, we ensure that the tumor is targeted while minimizing the risk of damaging healthy brain tissue. This technique is a promising complement to other treatment modalities like radiation therapy and chemotherapy, being actively researched to improve outcomes for patients with brain tumors. In conclusion, the field of electromagnetic neuromodulation is evolving at a rapid pace, with new techniques and technologies offering hope for patients with various neurological disorders. From non-invasive therapies like rTMS and tDCS to more advanced approaches like DBS and brain electromagnetic implants, these shaping the landscape of neurotherapies. The integration of implantable devices with non-invasive methods is opening up exciting new possibilities for personalized and adaptive treatments. As we look to the future, we are excited about the potential of these technologies to improve the lives of millions of people worldwide, offering new hope for brain-related conditions. Thank you for your attention, and we look forward to the continued advancements in this groundbreaking field.